Well, good day, guys. This is part 3 in our Pro Bricky Stiff Hacks. You might be suffering from ED or not sure why things don't work the way they should at different points. No good, when you've got to deliver and you just can't. It's like you feel like a fox lying on the side of the roadkill, embarrassed, demoralised, humiliated. You're not sure if the missus is going to go or stay, or if you're going to come home from work and somebody else is going to be banging her. Not her fault if you're not performing. Some women will tolerate it, but who knows what's going on behind the scenes. We want to try and fix that with these videos. This is part 3. There's 1, 2, and 3. Don't forget the upcoming videos on alphabet people. The transgender agenda with Jennifer, I forget her second name, but she's an investigative journalist and she is onto it. But what we're going to do now is talk about what is psychogenic erectile dysfunction. We've looked at diet, we've looked at exercise, and now we're going to look at the psychological part of this. Just a personal example, I can remember experimenting with drinking. Went out with the mates, had a drink or two, I was 18 at the time, picked up a 45-year-old, took her back to the crib. Didn't do too good that night. As a matter of fact, it was probably a failure, but somehow or other she stayed. I think she passed out. Did all right the next morning, and then away she went. But there was some psychological and physical issues going on. And at that point, I had to stop and look at myself because I'd never really found myself in that situation before. So I got onto some things pretty early in life on alcohol and all that stuff and how bad it is for you. So I didn't go down that road. But there's also things that don't get dealt with in our spiritual life, emotional life. And that's what psychogenic erectile dysfunction is about. So psychogenic erectile dysfunction is the inability to achieve or maintain erection during sex due to psychological factors. And these factors can include stress. I know a lot of you suffer from stress, anxiety, depression, guilt, low self-esteem, or relationship concerns. A lot of us have relationship concerns, and why wouldn't you if you're not performing in the bedroom? Would you agree with that, editor? I would. Yeah, the editor would. And about 40% of erectile dysfunction cases are considered psychogenic. That's 40%, guys. While erectile dysfunction can affect men at any age, and I was a sprightly 18-year-old and woke up pretty quick when at that point when I couldn't perform. While erectile dysfunction can affect men at any age, many psychogenic ED cases occur in young men when you're trying to figure yourself out, probably. But this article that we're doing here today is going to discuss symptoms, causes, diagnoses, and treatments of psychogenic erectile dysfunction. Some of the symptoms in failing to get an erection on occasion is not uncommon or a major cause for concern. But when a person struggles to achieve and maintain an erection during sex, at least half of the time it may be erectile dysfunction. And symptoms of erectile dysfunction may include inability to have an erection, trouble achieving erection, loss of erection before sex is over, premature or delayed ejaculation, and interest in sex but difficulty performing. It's important to keep in mind, guys, that symptoms may vary from person to person. And having awareness of symptoms and how erectile dysfunction impacts sexual performance can help facilitate conversations with a health care provider. And if you haven't spoken to someone, find someone that can help you with this stuff, okay? Now, some of the causes of psychogenic erectile dysfunction, and why would I be talking about this? Because I know a lot of you guys are struggling in this area. probably due to alcohol and drug abuse and that kind of thing. But some of the psychogenic causes of erectile dysfunction can be underlying medical conditions. To determine if erectile dysfunction is psychogenic, a healthcare provider will seek to explore and rule out any medical conditions that could be causing the problem. So if it's not a physical problem or a dietary exercise problem, it's probably something that's happening in your mind, right? And again, this is not uncommon. Alcohol alters your mind. Therefore, it's going to alter your response, sexual response to your erection. That's just one example. You shouldn't play with your mind. You shouldn't alter your mind. You need to have your mind where it needs to be when it's called upon, because your mind plays a major part in your ability to get an erection. After ruling out medical conditions, let me just come back to my notes here. Okay, so psychological causes that may contribute to erectile dysfunction include, you ready? Stress and anxiety. Now, stress and anxiety lead to depression. If somebody or yourself has got depression, come back to what's causing the stress and anxiety and you'll find out what the depression is. Why the depression's there. Depression's a result of stress and anxiety. It's not just a thing in itself. There are biological things that happen in a person that do cause depression, mechanical out of sync things within the person's physiological part of their being. But stress and anxiety is from an outward source that causes an inward disruption that can lead to depression. So when an individual is anxious or stressed, becoming aroused can be challenging. Performance anxiety. Have you ever, excuse me, editor, have you ever suffered from performance anxiety? Oh no, you're female, sorry. Worries about sexual performance or being able to satisfy a partner can lead to anxiety, which impacts the ability to have and keep an erection. Depression. And remember, depression, if it's not a problem with your system, will be coming from stress and anxiety. Depression can cause a lack of interest in activities, which can include sex. Experiencing depression can make it hard to connect with others, including in sexual relationships. And let me just say, women sense somebody that's coming to them out of a place of need, and they get tired of that after a while. It's all right at the start, but once you become a burden to them, shop shuts. Conflict in relationships can lead to emotional stress. That's talking about unresolved issues. One of my big sayings is, and you can sign this off, editor, deal with the issue before the issue deals with you.
Yeah, you will.
Thank you. And so emotional stress can lead and create distance between partners, which can hinder sexual performance. But don't forget, there's a place in a relationship where distance is helpful, but it's got to be from a healthy foundation. When it's coming from an unhealthy place and it's causing distance, that's not going to help anybody. Feelings of guilt, whether it's related to past performance, emotional stress, or other issues, guilt can lead to depression and anxiety and ultimately to erectile dysfunction. So you've got to deal with the inner parts of yourself that are unresolved. What about so low self-esteem? This can be related to performance during previous sexual activity and can lead to feelings of inadequacy or shame. So you've got to deal with these things, guys. Cultural or religious beliefs. Now, this is a big one. Religion will 9 times out of 10 undermine sex anyway, but a person's attitude towards sex may be influenced by their religious or cultural beliefs. And some religious beliefs, how could I say this? Subliminally, the way in which it all works can cause all sorts of sexual dysfunction in the way in which people behave amongst each other as well, because causing people to restrain can often cause an instinctual arousal, because it's not a healthy way to try and live. Sexual needs and things are allowed to be expressed in a proper and decent consensual way. And some religious beliefs cause people to have to be restrained, and it just leads to other issues and problems and dysfunctions. What about trauma? A history of sexual abuse or trauma can cause an emotional response during sex and in sexual relationships. So addressing these with mental health professionals is a crucial part to healing as well. So psychological reasons causing a person's inability to have and maintain an erection during sex are as real and valid as any other medical reason for it, for trouble with your erection. Working with a healthcare provider or mental health professional can help uncover what psychological factors are at play and how they may be worsening your ED. The cycle of psychogenic ED. Psychogenic erectile dysfunction can work in a vicious cycle, Anxiety, which leads to depression or depression, may precede erectile dysfunction and create problems. So if you've got anxiety, get to the bottom of what is causing it. And if you've got depression, try and find or get to the bottom of what's causing it. What you've got to understand too is, guys, some of this antidepressant medication, it causes erectile dysfunction. Did you know that? So I'd suggest, if possible, and I'm not a doctor, at least in medicine, be careful what medication you're taking and whether you really need to take it. Are you taking medication just to prevent you having to deal with an issue? Because that's going to contribute. A lot of this antidepressant stuff contributes to erectile dysfunction, and it'll tell you that on the packet. So anxiety or depression may precede erectile dysfunction and create problems when a person engages in sexual activity. Or a person experiencing ED may develop symptoms of anxiety or depression as a result of their dysfunction. And just on the other side of it, if you're causing, as a male, your female partner to have depression or anxiety, and they go and get medicated, because there's a lot of people now that don't deal with stuff, they just go and get medicated, that'll also affect her libido as well, and she may not want sex as much. Not because she just resents you for the way she feels, but also because she's medicated and it's disrupting her horniness. So let's look at a diagnosis in terms of what can be done here, just out off the cuff. So to determine the root cause of any type of ED, speak with a doctor or someone in that profession, and don't be embarrassed about it. Get in there and say, look, I've got problems with such and so, namely my Johnson, and I want to get it fixed. And they'll go through all the possibilities that what could be causing it. The hardest one usually is to come to the place where you're willing to talk about things that are undealt with in your life, because it makes you feel less of a man. But I would be doing that if I were you, so that you can actually become the man that you should be. Sometimes we don't want to talk about issues that are troubling us and that we're buried right back into our psychological recesses that are blocking the health and welfare of our being, and therefore our ability to perform. You've got to be in order. You've got to be on top of yourself. A lot of tradies drink their troubles away, but that ain't helping no one, let alone themselves, and take substances and do things that they think's, taking their troubles away, but unfortunately it's only making them worse. So you can look, they will conduct a thorough evaluation, reviewing your medical and sexual history, past substance abuse, and overall health and vital signs. See, substance abuse is a big thing in all this, especially for men. The way you treat yourself through your teens, 20s, 30s, 40s sets you up for when you're 50, 60, 70. Okay, I've got some mates that are 70 and they're like bulls. They're like stallions. And then I got other people that are fucking sitting in chairs and can't even get their ass up out of the chair. They're never going to crack a fat. But what you got to realise too, the past generations, the women had values that are different now. The women would stick by their men regardless of how they were treated. I don't know if that was right, but that's how it was. These days, if you get out of order, there's too many options for these women. They'll just go find a better option or sit there on their own. A lot of people just don't want the trouble that men that haven't dealt with themselves bring. And let's just be honest. Can we be honest? You know, a lot of us men are out of order. It's easy for me to get on here and do the dark female nature response videos and all that, and they're legit. But what about us? What about us putting ourselves into a situation where we don't get in trouble or let people down, particularly the women in our lives or the woman in our life, and so that we can't be reprimanded or have to do all this stuff? Because being a man and looking after yourself ain't all that easy if you get out of order. Okay, so healthcare providers can utilise a variety of tests and tools to investigate what the cause of your erectile function could be, and these could include, but aren't limited to, blood tests. I had a blood test
3 weeks ago.
about 3 weeks ago. I didn't go into the doctor to get it done. I had a private sports person who lined me up for a blood test, and I paid $285 actually, and it told me everything, didn't it? I'm actually doing all right for my age, but there was some things I needed to do, like up my iron and some other stuff, which I corrected, and so that just made me a little bit stronger and a little bit fitter. And these are the things that we neglect. I can't remember the name of that place, but it was a good way of doing it. I'm going to be doing it again soon. See, blood tests help identify potential underlying causes that may be contributing to ED, such as heart problems, anemia, or hormonal abnormalities, including testosterone, which is a foundation for erectile dysfunction. But these can also check kidney and liver functions and all those things that need to be in order in your body for you to be able to perform at your optimum. There's nocturnal penile there's nocturnal penile tumescence NPT test. They can do an NPT test on you, which measures erectile function during sleep. I mean, honestly, guys, you know you're running well when you wake up of a morning and you got a fat. Your body's spent the night calibrating, and if you've got a stiff when you wake up in the morning, that's a positive result. If you haven't, go and get tested before the whole thing packs itself in. There's urine tests, which can look for the presence of diabetes as an underlying condition, and there's thyroid tests. The thyroid helps regulate sex hormones. A thyroid deficiency could be causing ED. So once any other medical explanation is ruled out, a medical health professional can be brought in to determine if psychological factors are at play. So there may be a combination of things causing your ED. A mental health professional will conduct a psychological evaluation to determine if there is a psychological reason causing or connected to your ED. So in closing, let's look at some treatments here. Psychogenic ED is treated by addressing the psychological factors involved. The main treatment methods for psychogenic ED include, guys, psychotherapy. Therapy can help patients identify their thoughts and feelings related to sexual activity and impotence. Through therapy, patients can develop balanced thoughts about themselves and their relationships and sexual performance. There's couples counselling. This can create an opportunity for partners to improve communication about intimacy and sex, examine their sexual relationship, and gain insight and understanding of each other's sexual functioning. I think one of the important things to mention here, guys, is sometimes it's not your partner's fault. Sometimes it's your own negligence of yourself. Would you agree with that, editor?
Yeah.
Because, if you're not dealing with yourself and the problem's lying with you, there's no point taking your partner to counselling. She's upset probably because you're not where you're supposed to be. And your partner's not your mother, right? Your partner's not your mother. And let me say, your mother's not your fucking partner either. Some of you guys have never left home, and you need to get off the tit and start treating your partner and putting things in their right positions. There's relaxation techniques, implementing breathing strategy. Breathing's so important. And breathing through your nose. Did you know, let me give you a tip, this is just a quick little side thing. One of the big things that helps your circulation is nitric oxide. Nitric oxide biology is built up in your mouth. Your mouth's one of the biggest producers of nitric oxide. And one of the things that causes that to break down is mouthwash. All right, so if you're washing your mouth out with fucking mouthwash, you're disintegrating your nitric oxide levels that are produced in your mouth. And that's just a little tip about the little things that you need. If you're consuming alcohol all the time, you're just disrupting your nitric oxide biology in your mouth. And you need that for the flow of blood through your system to make it work at its optimum. These are all the things that undermine us that we're not aware about. So nitric oxide's vital to your performance. Implementing breathing strategies. Breathing through your nose produces nitric oxide and other chemicals and stuff that you don't get when you breathe through your mouth. Breathing through your nose is vital. I don't know if you knew that. Like during the day, you should be making a conscious effort to be doing breathing through your nose, particularly brickies and tradies who are, in the trenches. There's meditation or visualization, may promote calm and relaxation. And then there's medication, which I'm not a big fan of, but if it has to be, it has to be. And the healthcare provider may prescribe medication to physically help a patient achieve an erection. There's Viagra, there's Camagra, there's other things that you can use that can give you an erection, despite whatever your condition is. But that's not dealing with, we're trying to get to the underlying issues here. Or medication for managing psychological symptoms, including antidepressants or anti-anxiety medication. But just remember, the antidepressants and anti-anxiety medication can contribute to erectile dysfunction. Treating the body and the mind. If an individual's ED is caused by both physiological and psychological factors, a healthcare provider can recommend a combination of medication, lifestyle changes, and mental health care to treat ED. So, sexual health and function is an important part of a person's life. Well, it should be. It may not be to you, but it should be. And erectile dysfunction, whether it's due to psychological factors or not, is a very personal condition, but it can be fixed. Don't be afraid to seek help and to share your concerns with a healthcare provider, and doing so can help you identify the cause of your ED and create a tailored treatment plan to improve your psychological, physiological, and sexual well-being. Well, guys, if you haven't subscribed to the channel, please do. Press the bell, like the video, and share. This is the last one in this series, Pro Bricky's Stiff Hacks. And I'm glad that you've joined me. I hope to see you in the next series of videos. This is Pro Bricky. Bye for now.